It's indeed a privilege and pleasure to me to welcome you to this webinar, a conversation about the urgency to introduce front of package warning labeling in the Caribbean, that PAHO is pleased to co-host with the Healthy Caribbean Coalition, the Organization of Eastern Caribbean States, and UNICEF. In 2007, CARICOM heads of state and government met in Port of Spain, Trinidad and Tobago, in a truly unprecedented event. It was the first time that the region's political leadership had convened on a health matter, and this health concern was then causing the deaths of 7 in every 10 persons in the Caribbean subregion, and challenged the capacity of health systems, but also threatened to reverse economic and social development in the Caribbean subregion. This health threat was the non-communicable diseases. As you have heard, they include cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases. The resulting declaration of Port of Spain, uniting to stop the epidemic of chronic NCDs, elevated non-communicable diseases to the global stage under the leadership of the Caribbean, and led to the first high-level meeting of the United Nations General Assembly on the prevention and control of non-communicable diseases in 2011. A decade later, NCDs still remain the leading causes of morbidity, mortality, and disability in the Caribbean, as you have heard. The situation has worsened during the current COVID-19 pandemic, as persons living with NCDs are at greater risk of becoming severely ill and dying from COVID-19. Additionally, we are witnessing disruptions in essential healthcare services, as well as the impact of lockdowns and diet and physical activity, all serving to worsen outcomes for persons living with NCDs. Regrettably, there has been little progress in implementing interventions to address obesity. The Caribbean subregion now has the highest rates of childhood overweight and obesity in the entire region of the Americas. Unhealthy diets, excessive and critical nutrients, namely sugars, fats, trans fats, saturated fats, and sodium, are major contributors to obesity and the NCD burden. And the chief source of these nutrients is processed and ultra-processed food products. Supermarkets are crowded with thousands of packaged items, and shoppers spend only a few seconds selecting an item. Too little time to find out whether the product is good for their health or contributes to high blood pressure, high blood sugar, overweight, and obesity, 3 conditions which are responsible for almost half of all deaths in the Caribbean. There's therefore an urgent need to adopt policy measures that make nutrition information more available and accessible to consumers. As you have heard, front of package warning labeling is supported by strong regional mandates, which not only include the 2007 Port of Spain Declaration, but also the communiques of the 37th and 39th Conference of Heads of State and Government. And you have obviously heard also, we've had a very clear discourse about the work and leadership of CrossQ in this space. As you'll hear in the presentations today, there are several front of package labeling systems. A large body of scientific evidence has consistently shown that the octagon-shaped front of package labeling system is the best performing labeling system. And the randomized clinical trial, and I will point out that this is the most rigorous form of scientific investigation that was recently carried out in Jamaica, also indicated the superiority of the octagon-shaped front of package warning label. As a result of this study, there are now data of the highest quality available in the Caribbean region and front of package labeling systems for the very first time. It is a public health priority that we must make nutrition information more available and accessible to consumers who have the right to know through effective front of package warning labeling. A decade after the declaration of Port of Spain, the Caribbean continues to be the subregion of the Americas with the highest rates of premature mortality due to non-communicable diseases. There is, however, a unique opportunity for the Caribbean region to realize the vision of the Declaration of Port of Spain by adopting healthier behaviors, avoiding risk factors that are detrimental to our health, public health, and sustainable development by adopting front of package warning labeling as a tool that will help Caribbean people make healthier dietary choices the easier choice. I'd like to thank our distinguished guests and participants for taking the time to be part of this conversation and look forward to the full engagement of all those who are present. Thank you so much.